Hello. We're now ready to start Chapter 2, and Chapter 2 is about medical ethics and the law. As an administrative medical professional, it is your job to know about the ethics and the law. That's the way you can perform your job at the highest professional standards possible. Knowing the law will help you to resolve issues in the office, issues that may resolve confidentiality or patients' rights. This chapter will talk about the law, ethics, and etiquette as it relates to the medical professional. In learning this, you will also learn how to help prevent medical malpractice in the office. For example, we all know that you have to keep everything confidential. That could be anything the doctor has told you, anything you've seen in a medical report, anything you have heard. Everything has to be kept completely confidential. It also includes, maybe somebody might ask you, does so-and-so go to the doctor where you work? Even that has to be kept completely confidential. When you're talking with a patient, be cautious of what you say. Never talk negative about the doctor. That should be a given, but it's not to everyone. You'll be allowed to give some information out, and some information you'll not be allowed to give out. So you need to make sure that you know your right from wrong. Same thing goes, don't be talking about a patient in the medical office, maybe in the hallway, let's say. So for example, maybe the doctor is giving you some information about the patient to put in the records, or you're talking with another administrative professional. Just be cautious of who is around, and don't be caught talking in the hallway when there's a chance that somebody else may be able to hear you. So be cautious of that at all times. Also, make sure that you keep complete, accurate medical records. If a patient calls in and cancels an appointment, you need to note that. You need to be cautious of everything that you note. If the patient tells you that they are not going to take the medicine the doctor subscribed, or not do it the way the doctor subscribed, make sure you pass that information on to the doctor. Be selective in what you give out over the telephone. This chapter will actually go in detail over the HIPAA laws and make sure that you understand what you can give out and what you can't give out, and the requirements of that. So that's just a little preview of what this chapter is about. This chapter does give a lot of very good information that is designed to help protect you and to help protect the medical practice. Hope you enjoy your readings.